So I thought about you.
All right, it's okay, it's good. It'll be a transition.
Probably better than Dr. Oz.
I don't know, Oz is a pretty good surgeon.
Is he really?
Yeah,
I think he was a real doctor.
oh, he's a good heart surgeon. Run a big research lab. Oh, yeah. All right, this is the Desert Healthcare District Finance, Legal, Administrative, Real Estate Committee meeting, July 14th. A little after 3 o'clock, Desert Healthcare District Foundation here in the Regional Access Project. So call to order for this meeting.
We have a quorum, everyone is here,
Okay,
3:12 PM.
okay, approval of the agenda.
Second.
All in favor?
Aye.
Meeting minutes from last month are here. If there are any questions, we can talk about them now. If not, let's approve them.
Second.
Okay, all in favor?
Aye.
Any public comment?
No public comment.
Okay, public comments at this time. Comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to not more than 3 minutes. The Committee cannot take action on items not listed on the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. Still no public comments. On to the CEO report. Steve.
I'm gonna let Alejandro take over the Healthy Desert Healthy Use since he's kind of the main lead on this, but I did want to just mention one thing that we have a policy OP 14 that, that says section C, that all travel by district staff on official business outside the county of Riverside shall require approval in advance. Wait, CEO travel outside of the state should require approval by the board. So some of these conferences I want to go to, one is in San Diego, it's out of state, the other one is in.
San Diego's out of
San
state.
Antonio. What did I say, San Diego? San Antonio. What's that say? And the other one is in Kansas City, the mobile health. So I just wanted to know, do I need to put, do you think something in writing just to get permission from the
Just
board?
put in your CEO report, I would think, that way
Okay.
you're meetings, and if we have any questions, we would bring it up.
It will be an action or just, it will be an action.
Yeah, it's
Is
an
it her report
approval
next
for if the
Or
CEO.
is it five?
No,
CEO five?
Travels outside. the state.
Individual.
Okay, fine. I don't know why they put it in there.
Oh, really? What about interim CEOs?
I could go into the guys in the chief program officers. Improve myself.
Okay, yeah, I guess, I don't know how you have handled that in the past.
I don't think the CEO ever asked for approval.
I don't think so either.
Last year we asked DPHA.
Oh, okay.
At that point, we had full.
Did you have a board?
For the board members as well.
Okay.
Oh, the board
I
members.
think we can do that. The other thing to note is, yes, that was involved from a couple CEOs
Yeah.
back. So it's a policy. We could easily change it if it's not something.
It's good to know, but it shouldn't be restricted.
So it'll be an action item then?
Yeah.
Okay,
Okay.
that's fair.
Thank you.
Do you have a list of the ones you want to go to for the year? Have you looked?
Yeah, you have a whole list. In fact, we leave it out to the board, and if you guys.
But you have it, so that we can just kind of approve the whole thing, like, hey, you're traveling out of state for these 4
Yeah.
next year,
Put that in there.
and it's all done.
All right, yeah, so Healthy Desert, Healthy You, making a lot of progress. We have about 90% of the speakers confirmed. We have our two keynote speakers. One of them is Dr. Takashi Buwata from IHP. He's the second in command. Unfortunately, Jared was not available. He had a prior commitment. So he is sending his number two person to our summit. And then the other would be Dr. Angelica Jeter from Solon. She has an extensive and very impressive background in working in multiple levels of government, specifically as the chief health officer of the city of Atlanta during COVID. And she is very well versed on the social determinants of health, which are the focal point of this year's summit. So we're very excited to have them participate, and we have a lot of activity going on. Will is doing a really great job alongside Consuelo of promoting the summit. Last week we had a meeting with Hawker Productions, and they stated that as of last week, we had 190 individuals already registered for the summit. So we're projecting to have a higher number than in previous years. We did explore some items that, this committee and the board suggested we look into. One of them being the transportation issue. Just collectively as a planning committee, we all decided that that might be logistically a little bit too much for us to coordinate, given our staff size and our the vastness of our region. But one thing that we are working with is working with Sunline Transit Agency to get bus passes and get those in the hands of individuals that would like to come to the summit, and giving them that, that free bus pass. And looking at the routes, there is a route that drops off right in front of the river. So it would be on 111. So it'd be a short walk over to the Omni Rancho Las Palmas for those individuals that are seeking that. So we're still waiting to hear back from Sunline Transit Agency on those things. And then also Jeff is preparing a quote for the taping of the sessions. I know that was another another item that the board wanted us to inquire into. So he's looking into that. We as the committee thought live streaming is definitely not the way to go because of, we don't want to discourage people from attending in person, rather saying that, I'll just sit at work, be on my computer, continue to work and just kind of have it at the background, so we don't want to live stream, but we did agree that at least to look into the costs associated with, taping some of the, or all of the sessions, and then we'll present them to the board, and then we'll get further guidance at that point. Anything else? On Healthy Desert, Healthy You? I don't think there is.
Okay. Donna, anything else?
That's it. Thank
Sure.
you.
All right. I guess Eric, over to you.
Sure.
See where it goes.
So I'm starting on page 8. First off here, I was anticipating our new accounting manager starting today, but I left it open here. But Patty Mesa is our new accounting manager, started yesterday, so very happy to have her on and filling that role. Very much appreciated.
You needed it.
Yeah.
Talked about last week. You said.
Yes, so very happy to have her on board here. Just wanted to know, we've had an increase in different spam and phishing emails, and so Harry Slack, our IT consultant, is trying to find a couple different elements on how to try to reduce those. One being reducing or removing instances if he's found district emails listed in these sort of dark web listings, and then he's trying to get a new filter on there to try to filter out some of those elements as well. So originally he was thinking he was going to have it coming this week, but I don't know, he's still working on the dark web element, and anticipated starting at the end of this week, maybe early next week to get.
Yeah, I'm
that
getting a lot of
additional-
emails about people asking if you want to borrow money and stuff.
Well, the hard part is, public agency, our emails are going to be everywhere.
Yeah.
So we're definitely getting a surge of that. The key there is if there's any sort of financial requests that are coming from any of the other board, appear to come from the other board members or other staff, really, I would be on anything that you have, and I would make sure that you're aware of anything if it was coming from an outside source. On the Medical Plaza side, we started work on a new venting system for Building 1 West, to address some of the sewer and pipe elements we've had going on. So this is gonna alleviate some of the issues we've had with the current venting system. And while we're still working on the scope of work for the sewer replacement project. The scope of that's been a little bit longer, getting it together than we anticipated. It's a little more challenging, especially with public bidding, ensuring that we're detailing exactly what we needed, where in this case with the sewers, we see the original plans, but there's been lots of different tenant improvements over the years where the piping may have changed course. So it's not a defined, hey, here's what we need you to do, so that Rick from Impro has been working with Chris Mills, the architect, to try to figure out how to best present it in a way to ensure we're getting proper offers back that are being conscious of price, but it is challenging when there's elements like this that aren't clearly defined into what's behind the walls and just don't. But we're trying to work on temporary solutions beyond what we've talked about over the last several months as far as, as the urgent needs come up to replace small pieces of pipe or coupling or venting systems. This is just one other measure that we can take while we're waiting for the big project to get defined and released.
Can I ask a question about?
Yep.
Director Watson.
Oh, please.
Do you mind?
Yeah.
So the 25K is just for the venting system,
It's coming in under the 25K, correct?
under the 25K.
Yeah.
All right, because,
Okay.
okay, no, sorry, I was just gonna say, because I just, the checks that I signed and so in June, they were paid a total of 6 times, but that's for other work that they're doing not related to the venting.
Yeah,
Okay.
there's the standard monthly fee with Impro, and then there's been other more urgent needs that they've addressed. So like even in today's sequence, which isn't specifically on the agenda, but we had a couple electrical circuits that had some trouble, so they had to rewire some of those circuits due to conduit that's some of it from the original building, so it's degraded over time, causing issues with the wiring. And then there is a payment that I had in the check run for today that did have to do with a second progress payment on that venting system. So,
Thank you.
for sure. So yes, we are still 100% occupied. Rent to CAM's currently at 1,641,000 and 59. We do have one lease extension on today's agenda, which we'll get into a little bit later, but just a current tenant that's seeking a potential longer term lease, but asking for a few more months to review their options that we have. And that is all I have on my CAO report.
One quick question.
Oh, I'm sorry.
Okay, no, good, no, finish.
I realized this was the next one. So my last element for the financial element, I did want to note that on this particular month's reports, the financial reports did not include the income statement and balance sheet. Similar to our discussion last month, typically we have presented preliminary statements for the month of June. But for this month, as we're looking at or in consideration, the quantity of pending items that we had, I didn't include them in this month's reports. I had spoken with Donna and Director Logston in advance. The main thing is it wouldn't have presented a complete set of reports. There's still quite a few invoices that we're reviewing, and so all the income wouldn't be, I don't want to say accurate because that's not the right word, but it wouldn't be complete. It doesn't show everything that we're working on. With June, typically we don't close the month of June until after our audit anyway. And so we're still working on any respective accruals and whatnot. And so I know that's come up in the last couple of years as far as the preliminaries and should we approve them, should we not? It's just this year felt especially more incomplete as we had quite a bit of invoices we were reviewing that I wanted to make sure were reviewed and properly posted to the financials. Make sure. So with that, and then in conjunction with the discussion that we had last month, when we meet again next in September, that will include the new format of the financial reports, which will include all the deposit, check register, credit card reports from the month that just ended. It's just the income statement, balance sheet, and related reports will be presented a month later to allow us those couple weeks to close and make sure that all applicable expenses are reported in the associated month. So just kind of a heads up on why they were shorter this month. And that is all I had for the CAO report.
I think that makes a lot of sense to do what we're doing with those financials. we were looking originally, when we talked about redoing the Las Palmas Medical Plaza 2 months ago. About some of the rules about whether or not we need to go out for bidding in that respect. What did we end up deciding on that?
We did adopt the,
We adopted it fully, right? That-
yeah, we
that
we
policy.
adopted it. There's
Okay.
just some work that I'll have to do to find out what projects would be eligible for that particular adoption and what documentation that we have to do so.
Perfect.
In this case, the sewer project is going to exceed that $220,000 increase because our current sequence shows 25,000 or more would need to be publicly bid. In this case, that would allow us up to 220, but there are certain circumstances that we have to ensure that we follow inside. I want to be fully up to speed on that before we execute any.
Okay. I just want to make sure we're
funding.
still working towards that, so that will give us some leeway. Okay,
Yes.
thank you.
Oh.
Yeah, please.
One question. So when we do big projects, we are held to prevailing wage?
Correct. Anything over 25,000 is the prevailing wage.
Thank you.
And if we were to give out grants to those capital improvements, they'd have to use prevailing wage as well.
Okay.
That's good.
Financial report wise, you want to highlight?
Well, financial reports, since a lot of these are just reporting what happened, I can answer any questions on those. The element I would just point out here on page 22, just our retirement protection plan update. So on this one, we are down to 93 participants as of the end of June. We have had 2 additional requests come in since then that are in my inbox that we need to get processed. And we are working with NIHART to finalize the narrative on the letters that'll be going out to all the participants. And so just a quick overview on that. We're hoping that those will all go out and that anybody opting to have a lump sum would probably be paid around the end of October, November is the current plan. And then with any of the folks that either opt not to do the lump sum or who may not be reachable and we have to do a little more research on those, having those be what transferred out to the outside insurance to take over, and that is anticipated by February. So the goal here this current fiscal year, the ending June 30th, 2027, should be our last year that we're going to need to have the financial audit relating to that. Good, if everything goes as planned. And then, if we can go to the next page here, just wanted to note in case this came up, one, I put preliminary on the grant reports because we're still finalizing a few things. All the payments that we're going to have have already been processed, but we're just trying to validate that there's no unexpended funds. So at the very bottom, I just wanted to highlight that we are showing as of the end of the year, an available balance for grants tentatively at the just under 57,000. The main elements of those we had when we had requested the increase to the budget towards the end, I think it was in May, we had included in anticipation, there was 2 mini grants that we were in the process. Both of those didn't end up getting awarded or didn't have the appropriate documentation in order to proceed. And we did in that period also have 1 grant that had some unexpended funds. And so whenever we recognize those unexpended funds, it shows as a negative expense and ends up shown as available here. So.
And those are, when they're unavailable or not used, that's permanent, right? Grants closed, that
Correct.
money comes right back. Okay.
That would happen at the very end of it, because when we award grants, we'll expense the entirety of it and set up a payable. We get to the very end, if there's any remaining balance, then we would reverse that value on the grant expense.
That's a good question about.
Please, yeah, please.
Okay.
I have more questions about it. I want to hear what you have to say. I bet it's the same.
Mine's probably a simple one, but, so on the grants not used, laughing, it is a reasonable one. All right. There are 4, so number 1430, I didn't see that one, maybe it just didn't make it there, but I don't see 1430 on the list. It goes from 1421 to 1432. So I just wasn't sure which grant or the number, if it was just a typo.
That could be, I will have to look at here, because generally what we will do anytime we have the unexpended funds, we'll add that additional line and reference the grant number. And then on the, towards the right side of the doc, it'll show can you scroll over to the right, just over it there, please. But yeah, so as an example, about midway through where we see the 36,950 58,
Mhm.
that we had unexpended funds. So I'll double check that the grant number would be a typo, but I believe that would be a potential, but I'll have to look into it. But thank you for noting that.
See, good question. Short. I have another question.
So I have a question, the discussion that we had last month about those organizations that were denied because of no funding and then because it was too close sponsorships. I think there was like 12 of them, I think, was that
Sponsorships?
the sponsorships, I think it was like 12 of them. Okay, and then that conversation started here, I believe, maybe also, I'm not sure, but we talked about it here and then we continued it to the board meeting. I thought that it was going to be discussed further at the program committee this month, but then the program committee is not happening. So it's not gonna have any resolution or recommendation coming to the board until September. So do you have some plans for how you would
I
handle
don't
that?
recall what the discussion was about to go back to program committee.
I thought
About
that we were
revisiting it then, and-
revisiting those to see whether they qualified, other than the fact that we didn't have any money and now that we're disqualified because it was, because of the period. I thought it was gonna go
I
back.
think we had a conversation at the board meeting when you were asking about the sponsorships, and I mentioned that we did our due diligence on all of them, and all of them, they were declined. It wasn't because we didn't have the money, basically, even though it was part of it. It was really specific reasons why most of them were, all of them were declined.
All of them, so there were none that were,
Not really.
I was gonna suggest that you would consider them as your CEO discretionary if there was some that were, so. Is there a way that we could know what those reasons are? Because it
We
would.
did outline them in
In the
the staff
program committee?
report, but I mean, if we really want to get some kind really into the weeds with it, we could show you why some of them really.
Maybe just
declined.
on one-on-one, so I could have some, I don't know if the rest of the board is interested, but I know I'm interested in finding out. A little bit, because, I just, some of those events, I just was really thinking that we were going to be supporting of them. And I thought they were going to have an opportunity to revisit them and to find out more what was, were they gonna be moving forward or not? So I'm kind of left in the dark as to what was the outcome.
In the summary of them, I think I remember seeing something.
Here
where you
they
guys-
are up here.
There you go, yeah, why they were denied, here they go. Couldn't quote them directly, but
Yeah, but I thought those were separate than the 12. I thought these were,
Well, these are them.
I think
These
this
are
is,
the
I
12?
think this is what you were referring to.
Those are all the ones, yes.
so that was from last month's meeting?
Mhm.
Mhm.
Okay, I'll look at them again.
Okay.
If I have questions.
If there's any people, okay,
Okay,
yeah. if
Thank
there's
you.
anything-
The thing I remember also being talked about is President Barraza at the meeting, and I believe Ally from Rapid inquired, because legislative, here it is program. President Barraza had asked if there was the potential for using some of the funds identified on the foundation towards that. But we had looked into that, and the key there is the foundation funds could be used, but that would be outside of what our current policy is. And so what I had noted from that is, and what we discussed is bringing a revision to the sponsorship policy to the next one, or to the next scheduled meeting, which will end up being September. And that way we've got some ideas on how better to address that, so that situation there potentially come up. And that was my takeaway from in the board meeting to.
I'll look at this and see what those reasons are.
Yeah.
If they're relevant and it wouldn't have made a difference if they're only for those two reasons. I thought it had to do with first that we didn't have any money and then we increased it and then it was too close to the date for the 6-month period. So I thought it
Yeah,
was.
well, we looked at the fact that this is what we do have left, and then which one would fit the best. That was what with the parameters like the UCPIE and I can put the other one was, but it was thinking the best.
So yeah, I'll look at them and then if I have any questions or think that there's a need to revisit them, I'll talk to you about it, maybe convince you of an alternative. Of, bringing it forward for discussion to the full board since we're absent of the program committee. But if, maybe it's not even necessary. Thank you.
Any other questions on the financial reports?
Yeah, just a quick clarification, going back to the A and R, so that,
AR.
Fund, AR, yeah, AR aging summary.
Yeah.
So that DAP health, so that's, just so I can
It's all
understand,
normal.
it says unexpended grant funds though,
Sure.
just to get an explanation, so I understand.
They just didn't spend all the ones that were approved line item budgets.
Yes. Yeah, I'm just, no, I want to make sure I understand.
Page 11.
They just had some money left over, they from some of the
Mm-hmm.
line item budget that they didn't spend totally.
Okay,
I know they were having some difficulty with their community health workers in the different clinics, whether they weren't working at one particular clinic and then moving some other people over to another clinic. But they just, that happens, they just sometimes just don't spend it all.
and so then they're gonna pay it back to us.
Yes,
Okay.
Right, 'cause it's, if I could jump for 1 second
not
on that, usually when unexpended funds come up, it's out of the 10% retention, because we typically will advance the funds and feels like 9 times out of 10, the unexpended funds, we just give them a smaller retention. In this particular case, their unexpended funds exceeded that last 10% retention and actually went into the advance that they had already received, and that's why we're requesting it from them. But it doesn't happen very often. We have to request any of the advance back.
Thank you for clearing.
One more thing. Donna, are you getting any requests for you to consider as your CEO discretionary fund?
no,
Okay, you're not getting them now from.
we just had the one that we had a phone call, but that was from the city of Cathedral City.
Something regarding a donation, but.
Yeah.
And do we have to do anything as the board to say that you are able, because I thought that you would be, because you're acting as a CEO, so there's right?
Spend. I don't even know how much is in there, but,
So do we have to do anything to make sure that you do have that that prerogative to make that decision utilizing it? Because here we're having it every month, having some, and then all of a sudden in June, of course, when you took over, nothing. So I would think that there's still some things that you
I haven't
don't.
had any requests, no.
Okay, but so we don't have to take any action. It's yours to use. Okay.
So.
See, and just to answer the question, 75,000 was budgeted for the CEO discretionary for this fiscal year.
Drinks all around here.
Did those requests used to come to Chris and the previous CEO, or did they, how did that, why is it all of a sudden nothing's coming, it's dried out?
A lot of it changed when we started having a separate sponsorship line.
Yeah.
There were some elements that the CEO would approve if there were some sponsorships that maybe didn't fit the normal guidelines but had a benefit. There were several different types of community events that like Alejandro would work on and request from the CEO. A lot of those were paired with work on the foundation side.
Okay.
They would generally request. I haven't seen any either.
And we would normally sponsor the farm worker events, the farm worker appreciation events where we purchase lunch or the burritos for the farm workers, and then other entities like Growing Coachella Valley, the California Farm Worker Foundation will bring raffle items. So Growing Coachella Valley would select the crew, and then we would go and provide food and the raffle items just to show our appreciation to farm workers. And then we also did Huh? Yeah, opportunities, yeah. Opportunity drawings of opportunity or opportunity drawings. Yeah, opportunity drawings. But we purchased the food. But then we also sponsored the annual Coachella Valley Equity Collaborative picnic, those items. And those are typically in the fall. During the summertime, it's still we don't end up to do too many community events.
Good. Have a motion to approve financials.
Second,
All in favor?
I.
Aye. Any public comments?
No public comments.
On to other matters. We've got a lease extension for Palm Springs Serology in the packet.
All right, so on page 24, Palm Springs Urology, they're currently on a 1-year lease. They've had actually purchased the practice from Dr. Wilson back in January of 2025. We had executed a one-year agreement with them as they were looking over their options for long-term lease. And they just recently contacted me as we were trying to propose new 3 or 5 year terms and just asked if there is the ability to increase this current agreement by 3 months, just so that way they could continue to review their options. So our recommendation is to approve that extension. We have had similar situations come up in the past as tenants are trying to make sure that the long-term lease is the best for them.
I'll move it forward.
I'll second with the comment, if I can, that just to make sure that the name is clear, because it says it's, and I checked it, so it's Urology Medical Group, but then in the background it says PC LLC. So I think we just want to be clear about the legal name of the entity. Maybe it's just the agenda that's not.
Thank you.
It has to be a professional corp, yeah.
I'm sorry.
Because the medical practice has to be a professional corp.
But is that who needs to be on our?
Urology medical.
I will double check. I have, the Palm Springs Urology Group is what, we
You're
have.
correct. They're doing businesses.
Doing this.
They're gonna do
Mhm.
business as Palm Springs Urology Medical Group, but the actual entity that you're gonna be leasing to is different. It's gonna be Inland, at least the way I read it, Inland Urology is gonna be who it actually contracts with, right?
And when the
Hello.
first,
Right, it's your,
well, now, yeah, I'm sorry, and that was also what was there. When we first set up, they were as Inland Urology, and then as we went through and executed this one agreement last year, they requested that to utilize the new name of the Palm Springs Urology Medical.
Signature. You know, if these things end up somewhere, we gotta be. About who
you're leasing to.
Right.
Exactly.
who's the.
Do you get a new tax ID from them?
No,
If they're doing
Yeah.
TPA,
they
then
just gotta file it with the local area, make an announcement in your paper. Okay. So we had a motion, I think, to approve it, and in a second. All in favor?
Aye.
Aye. Any public comments?
Nine.
Next section, activate inclusion is just,
yeah, it's
it's a discussion, I think, about.
discussion of possible action. I wanted to bring this back, or we wanted to bring this back to the board because at the last board meeting, we had presented a couple options, because there were some remaining funds under activate inclusion. And the board had opted to, approve an addendum for an additional year to use those remaining funds. After that approval, but prior to us executing that, we got notification from them that activate inclusion was dissolving. We'll continue their work through August 2026, but after that, there would be starting a new organization, would still be available as needed, and so wanted to bring this back because our recommendation is potentially not executing the addendum and wait to see what happens, just to avoid the potential of executing the addendum. If they change names, it's not an organ. From what I understand, it's not an organization just changing names, it's a complete separate organization, so we could potentially contract with them under the new organization once they're up and running, but I wanted to get your feedback on that since the approval was what happened at the last board meeting.
I'm going to exercise staff's recommendation not to execute the addendum.
Second.
Any other discussion on that? I agree with that. All in favor?
Aye.
Aye. Any public comment on that?
No public comment.
Thanks. Informational on the mobile medical clinic services.
Yeah, so, we just wanted to provide the FNA committee an update on what's currently happening with our 2 medical mobile clinics. With the original agreement that we entered with DPMG Health with our first mobile unit and then the second one, those contracts expired, or ended September 2025 for the first mobile unit, which was a 3-year contract. And then the second mobile unit contract, which included the building of the pharmacy hub and then also the mental health, behavioral health hub where they were doing telepsych services out of at our 555 Tachiba Plaza. That ended in October 2025. And in order for us to continue working And providing these services to the community, we executed an extension as a services contract from February first of twenty twenty-six to June 30th, 2026, in hopes that DPMG Health would get their audited financials and their 990s to meet the requirements and be in compliance to be eligible for additional grant funds. Unfortunately, they did not provide those documents. They did provide a 990 that I believe Eric is still reviewing, and their CPA is working on their audited financials, but we still don't have those audited financials. Very unfortunate. It's a very hard decision. We did seek legal counsel. Jeff stated that, our best route moving forward is to execute or put out an RFP to see if there's additional providers out in the community that could, provide the same services that DPMG Health. And DPMG Health, if they do have their audited financials and their 990s in place and approved by our CAO and interim CEO, then we would move forward, considering them as one of the potential vendors that could, be awarded the RFP. So we just wanted to bring this to the FNA's attention and just to let them know, unfortunately, this means that our 2 mobile clinics are offline starting July 1st. The time period, we don't know, depending on the RFP process. I was doing some research, just the licensing component. If another entity was awarded the RFP, it could take anywhere between 6 to 9 months for that licensing.
With the healthcare, is that with?
That's with California
Public
Department of Health and Health and HSS.
Can we,
Um,
I got a list of questions for you.
So that's our predicament that we're in currently. We tried working with them. That's why we gave them the extension in hopes that they would get it before this deadline of June 30th came upon us, but we don't feel comfortable extending another contract with them until, we receive some of those financial documents. So just wanted to bring that to the FNA's attention and ultimately the board's for the guidance and
So can we be here? I have a list of questions. I've been thinking about this, hoping this day would come, but can we be licensed as our group? Can we just hold the license here? Meaning can the healthcare district be somehow? Meaning, what would the process look like for us if we're gonna run the mobile clinics? And that way we don't get in this setting where if we go out to RFP or if even our policy says, hey, we gotta go get vendor, every 5 years, we gotta have a vendor turnover and or a vendor RFP and we choose somebody else and we get this delay. Is that an option to where we say, hey, this is in our long-term vision? Should we look at having our own license here? And it's different than where we are now completely, but I think it warrants it because the license stays with DPMG, right? How the was.
yes.
Yeah.
Well, we did initially when we were
Yeah.
looking into getting this 2 mobile units with the first one, legal counsel recommended that we don't go that route.
Agreed.
Because
I mean,
he said it's a long process. It's
doable. It's just
Yeah.
Yeah.
And that's why we opted, doing an RFP for an operator for our mobile clinics. So that was the reason why we didn't want to get a license. It was just to.
What happens with like any of the equipment? I mean, did we buy equipment with grants and stuff? Is that still accessible to us? Like if we pull trailers or whatever we use, trucks, like how do we?
We do still own the 2 mobile units. We have access to them now. There's very few equipment that DPMG Health purchased. Outside of tables, chairs, canopies, things like that they would utilize for the clinics. But no, there's not any specialized
Vehicles or
equipment.
anything? We
No,
own everything.
But they own-
Except-
They own the truck.
except we have they did buy a Chevy, truck to haul the trailer. But when they
With
were
the grant dollars.
with the grant dollars, yeah, so that's their asset now. Not ours. So we do to,
I was just gonna throw out one other element that there is an active vendor contract with DPMD as it stands for them to utilize both units as long as they continue to provide us the necessary license and insurance, which we have at this point. It just doesn't come with any reimbursements. So if they opt to pay for any of those services, they still have the ability to utilize those vehicles at this point.
And the way that the current contract was structured was not like a traditional grant where we would give them a lump sum upfront and then they would draw down from those with, from those funds with reporting on a monthly basis or quarterly, however we have it structured. This was on a event basis. So if they showed up to, let's say, a sports physical and they had 4 doctors, 3 MAs, so we had the per hour rate for those individuals, so we would just reimburse them, so they would invoice us for each event that they would participate in, and then we would just cut them a check. I would work with Eric to verify that they did have all of the staff available or listed at those events, and typically, myself, Sergio, or Beleno, a combination of us 3, if not all 3 of us are at those clinics with them, so we are able to verify that they did provide those services. So for us, it was, the
Easy.
reporting, there were some issues that we did have with the 2 grants, with the delay in reporting. But under this new 6-month agreement, some of those issues were resolved. They do invoice, in a timely manner now. Before it used to be a couple of months, now it's a couple of weeks when they actually do the turnaround for the invoicing. So we felt comfortable with that structure because it was not like, a grant award, it was a lump sum. It was just, you showed up to an event, you bill us for the staff that was there. And then if there was like vaccines, then we would cover the vaccines for the children that did not qualify for the Vaccines for Children program, or when we did the women's wellness clinics, we would reimburse them for the lab, LabCorp charges for the specimens for the pap smear. So it was a very clear cut. You provide a service, and then we would reimburse you.
What about, are they using any of our space, rental space? Are they renting any space in Las Palmas?
You have 4 suites currently. Not possible.
Do we use any of those for the mobile clinic? No.
Just 2 parking spots. That's all we use.
Oh. Yeah.
So you said that staff feels uncomfortable with the extension of the agreement. And
The vendor contract.
with the vendor contract.
Actually, the legal counsels basically saying that you shouldn't be doing it.
And the
So
reason-
public-
Because it's been too long of time.
Mhm.
Okay, could we do a contract for events, so we just describe per event instead of doing it as a vendor contract? It'll be structured differently.
The issue is giving them money without audited financials at this point, because we can't prove where the money, we have a pretty good idea, but we just need them to submit the audited financials that show this is where the money went
If
before we
they're
give it.
submitting for documentation and that documentation is what is they're being paid for. Can't be done now.
And we
Not
explored all
legally.
different options with legal counsel, taking everything into consideration, and while at the time, legal was comfortable with the format that we were using, and I forget where else, but he talked about other cases that came up where, yes, it's a vendor contract, but it still is treated as if it were grant funds, and in this case, if they don't have the audited financials, they wouldn't be eligible. So for any future elements, he was saying. we need
Is
to
there
say-
any idea of when their financials are going to be complete?
We've been asking for a year.
Has it been a year?
Almost.
I was gonna say, I was like up to 9 months in my head. I thought.
There's just no reason why it should. take
We
so
advised
long.
them back last July that, by the way, 2 grants that you have open expire September 30th and October 31st. If you're gonna reapply, we need to have those on.
And we brought it up a long time ago. I think that we discussed it every month, and I made some phone calls.
And so it has actually been done formally, a letter to them saying that by a so-and-so date, if you do not provide it. Because I can see how they could, spin it around that, if they are providing a useful service, which we acknowledge, but that these services can continue. It has to be, there has been something in writing telling them what they needed to make.
There was some
I'm sure there was some.
There was some communication from a call that we had with legal counsel, and then Jeff did communicate to them that we needed those specific, we did receive the 990s for 1 year, I believe. But we're still waiting for the audited financials. And my last conversation that I had with Dr. Samoa, who is their admin officer, she said that, their CPA is working on them, but he took the 990 as a priority. So they did get us that. I would admit, we have made small incremental, progress, but we're still waiting for those audited financials. And I think, based on legal counsel's recommendation, that's just the situation that we were trying to avoid with giving them that extension. So
Give
they
them 6
could,
months, which we don't even usually do that.
So with this information as it's moving forward, can you provide that additional information of when that last communication was done and that at that time they put in writing that if they are not providing, give them one more chance to ask them, what is the timeline here? And that they are not providing it and that they only submitted the 990, which is not sufficient. And that, I just want them to know that this is serious and that I can't imagine why it's taking a year.
They even asked for different accounts. I went to Tally and Tally gave me a whole list of accountants that specified.
Yeah, we've done a
They're
lot.
a
I mean, I've been
nonprofit,
speaking to
yeah.
Dr. Kim at least probably almost monthly about it. Just offline, phone call, hey, where are we at on this? Trying to keep. I get it. They got a lot of priorities and things.
I did want to note though, it was, I believe, the March special meeting, and I think it was when we had the here, if I'm recalling correctly, it was either the regular or
It was the
The
intercare
special
meeting, was it
meetings,
March or
but-
before that?
where it was specifically noted, you need them, it was said, we had them, we'll get them, at that point, and then the grant applications they have submitted prior to our March 1st deadline ended up being declined because of.
Well, they
not
had just
qualified.
one sheet that said, we are working on our audit financials. We said, "No,
So
we
that-
need the audit financials, especially when you're asking for $2.5 million.
Formal declination in writing that would have specified that, so they've had multiple instances just to get it. And then I guess I would throw in, because when we're having the conversations with Alejandro, I'm usually the guy that's not very fun as far as, the finance side and compliance, but.
Wear it well, you wear it well.
So they have been, a great partner on there, and they would be eligible for applying for the RFP. It's just they have to meet what we have on the grant side, and so that was really the thing that the legal counsel is saying. It's just
Balance.
anybody
Yeah.
that needs
It was
to.
9 months at least.
at least 9 months, if they're not awarded, because they already have the license, so they would just continue business as usual. But if another entity, and I've been doing extensive research on it, and California Department of Health requires that, Health and Human Services also requires them to have a medical license, and if it's a entity, the new entity, they have to go through the whole application process, and,
That's why
even
they wanna
somebody
just-
like Eisenhower with theirs, it took them about a year to just get a license.
Yeah, I think we should maybe look, that's why I said we might just want to look at holding a license here, whether we utilize it all the time or not. Then you just have that flexibility, because now you have 9 months. Can't use one of our biggest things in the community. Unless they decide to use it and not be reimbursed from us for it, which is possible.
To their credit, from October to February 1, they did go out on their own without any reimbursement for the district. They were very selective on the events. We scaled back dramatically the number of events, but they were still going out there without us getting paid because they did have that operator agreement still, so they could utilize them, but without any reimbursement or resources from the district. Right now, just at a glance, the impact is 400 children are not gonna go with their Tdap, 150 women are not gonna get their pap smears. We're gonna have to stop services at the DHS homeless clinic, at the Palm Springs Navigation Center, and Martha's Village and Kitchen. The newly established pediatric clinic is gonna stop. The recovery home and Sky Valley that we go to. And then we had several TK and kindergarten enrollment fairs with all 3 school districts scheduled.
Is this something where, and I don't want to, we can take this offline, but can independent physicians come and just work under their own license? I don't know why they couldn't. I can volunteer anywhere I want to. I mean, that's something we could do.
That would be legal counsel.
I don't think it's even legal. I think it's more or less, well, I don't know. Actually.
That's getting your own mobile commissioner's license. I don't know.
Well, you would just, I mean, I have my own
We
license.
don't have our own license, but.
No, we have our own medical license.
So
Not-
like, you know, it's like the VIM, they volunteers medicine, they have like one doctor that, the med malpractices would be under that one. Doctor, and then so volunteer
What
doctor.
you would just offer to cover, you know, a malpractice, you could sponsor a malpractice policy for, you know, like locums agencies do it all the time. They say, hey, we're gonna place doctors all across here, and they get an insurance policy and just cover it. For, and you could do it specifically for that, and then you could have, there would probably be enough physicians to come out and run, to do the TDAP.
Maybe volunteers in medicine, all their volunteers.
I have a few pediatricians that I think would be willing to do that, and even nurses to go do that. Anyways, it's not a dead end, but let's talk offline about
It's
it.
not a deadline, dead end, all right. There's also nurse-led model, where you
Yeah.
have a nurse that would do.
For a lot of this little stuff, I think it's very reasonable, but
I'm just curious to find out what is the problem here? What is it? Is there something that is gonna be solved in the next couple of weeks, or is it gonna be, is it so serious that it really is not feasible to explore that relationship anymore, that we have to actually start thinking about
we have to.
a plan B?
Or do
I think we should have a plan B anyways.
Yeah.
It's, all the time that we've invested in them to
Trust
do
me,
this.
I've made the argument back and forth and up and down, sideways, you name it. But, you know, we do give them enough time, Director Lara, and it's unfortunate that we're at this juncture, but, you know, it's, you know, I'm, you know, a huge, you know, advocate for this, obviously, and, you know,
Thank
just,
you.
just taking this offline.
Well, just the fact that you have to put every effort in. Okay,
On to the next one, about the Vision Mobile Clinic, I think we have something to review here.
Yeah, so based on the amazing results that we've been getting from our vision clinics that we've been doing in partnership with Less Than Act, pre-clinic, we want to get guidance from the FNA committee and exploring two options. Option one is to purchase a mobile unit and optical fabrication equipment, then release an RFP to contract with a qualified operator to provide services, somebody like Less Than Act or others. And then option two is contract with a qualified mobile vision provider that supplies its own mobile unit equipment, staffing, and operations. And in the staff report, I highlighted what we would like to do as an organization with our vision mobile unit is I would like to operate it 3 times a week, approximately 43 weeks annually, which translates to 129 deployments each year, which potentially could impact 6,450 district residents annually. We will prioritize children and students, low-income families, agricultural workers, uninsured residents, older adults, and then those communities that are experiencing transportation and healthcare access barriers. We do have some quotes for the equipment and the mobile unit, the Vision mobile unit. We're looking at about $110,000 for the equipment that you saw, which is the dry eye analyzer, and then the edger, 2 edgers, and 1 edger and 2 cutters. The edger is the analyzer, the one that scans the frame and then sends it over to the 2 cutters that use water jets to cut down the lenses, as you saw. You know, I think purchasing the mobile unit and the equipment and having us own that asset, I think is advantageous, as we just, you know, talked about with DPMG Health, continuing to hold that asset, even though they're not an operator anymore, we still have that asset. And it will give us the flexibility to do more events. I see this, you know, deploying this Vision Mobile Clinic 2-3 times a week, you know, and be able to
Everywhere.
to go be everywhere and be able to provide just some data sets that I was able to pull.
What's the mobile unit cost?
The mobile unit, we have 2 quotes. We have our
Was the 110 all inclusive, or was the 110 just for the eye equipment?
Just the eye equipment, installation and training, it's $110,450. And then we have two quotes, from two mobile unit manufacturers. One of them is Magna, which is the one that built our two, current mobile, clinics. That's at $233,195. And then Coachworks, which is based out of Riverside, came in at a higher amount at $255,799. If we would recommend one of the two, we would go with Magnum because they do provide a 5-year warranty on the build, whereas Coachworks only provides a 3-year warranty on the build. And we've had really good, experience with Magnum, even with our two current mobile units, the awning was not working. They recommended a local, vendor. We drove it there, they fixed it, no issues, no bill. So, we feel confident that Magnum is the right choice, but we just wanted to present these two options to the FNA to get further guidance on which direction we should go with this Vision Mobile Clinic.
And the pricing for the equipment, did you get that through like a vendor service situation where they, hospitals go to like, kind of a group buying situation to where you can kind of see what everybody across the country is paying for what, so you can compare apples to apples? I don't know if that's been run through that system or not, because oftentimes there's significant savings if you just say, hey, well, you sold it to these people for this amount. And so I think we should just validate that. I don't know how these companies work when they see government money coming in. If it's like anything else, they usually racket the price up. So we have this system at the hospital that says, hey, I'm going to use this. You've charged this to these other 100 hospitals. So we're going to pay the same price or less. And so it would just be nice to
Compare.
just to confirm that,
Where do we get that quote from for the Vision X?
Vision X, yeah, it's through, Less Than Free Clinic. I asked them to get a quote, so I'm sure they got the best quote.
Yeah, sure did. Yeah, they ran through another clinic. Yeah,
Yeah,
they probably
yeah,
did.
Yeah, so
just
it
to,
ran through our current,
just to make sure that it's just something to look at. It may be the best price. I don't know.
So, the other part of that being, besides equipment, you have the human element.
correct.
Okay, so if we, contract with somebody, experts that do this, then they're responsible for their employees, they're responsible for that liability. They're the experts in that area.
Correct.
If we purchase our own equipment, then we have to hire our own people, or how does that work?
So just like we did with our two mobile clinics, we would, put an RFP out for an operator.
Okay,
And we will list the specific, details and services that we want from this vendor. There's very few of them, here locally, even in the region, I would imagine, if any. That could potentially do what our current vendor does, but we want to go through the proper steps to ensure that we open it up for a public bidding process to ensure that, we all feel comfortable with this process, that we're transparent as possible. Especially with utilizing taxpayers' dollars, we want to go take that additional step. But they would not be our employees. We would, provide that operator contract, vendor agreement, or grant, whatever we want to structure it as, to that operator, and they would have to do all, the hiring, the training, and
okay, I'm okay with it now. If that's the one that you're recommending is to go down in that direction,
I do.
I agree with you.
Option one, yeah.
Okay.
So it's about $69,000 a year, over 5 years approximately would be spending just for equipment. Assuming the equipment's under maintenance, sounds like the mobile unit's under maintenance, so 69,000 a year. How many clinics do you think? Do you think you're really gonna do over 1 or 2 a week?
You could, yeah.
So,
Just with the school district itself, there's the Coachella Valley per, a report, pediatric vision services. There's about 14,354 uninsured children without vision coverage, and another 6,000 uninsured children whose families don't know that the eye could even have vision care. And that's not including adults.
Yeah,
So we could run this 3 years and not even make a dent with the student population before we even open it up for the general public outside of students.
yeah, I mean, I'd say almost every school in every district, whether it's Palm Springs, Palm Desert, Coachella, nobody covers vision insurance for kids usually.
Yeah, and we would work with also, a great point was brought up by Gracie in the conversation at a staff meeting earlier this morning. working with, another grantee, which is Vision to Learn, but they primarily target elementary age kids. So we would, work with them to see where they go and where they didn't go. And maybe even tap into the referral process, but also targeting middle school and high school.
How does the
Those students.
insurance work? If they qualify for Medicare or other insurance, would that offset some of the costs or no?
We could explore some of those,
More complicated, to be honest.
It's
probably
it can be,
cheaper.
but
Yeah.
I think where we would utilize the insurance component would be for those students that need additional services with a specialized optometrist. If we, because these will be operated by opticians, not, optometrists. So then we would flag those students just like we currently do with the folks that we refer out to San Bernardino. We will flag those students and then refer them to an optometrist. And we're in conversations right now with Western Medical School out in Pomona to see if they do have an optometry, to see maybe they could have some students come out on a monthly basis to see some of these individuals that we might, that we will flag. Yeah.
And Vision to Learn does get reimbursement. Medicaid.
They do. Yeah.
Okay, so the opportunity is there.
Yeah, so, I think for us, and then if we were able to get them with, the optometrist to continue if there's any kind of, but I think for us, the focus is just corrective vision at the moment, not any diagnosis of any eye house, but that's where we would make the referral to the optometrist to do
They'll
that
pick it up
further.
and then they can.
Exactly.
They'll pick up the.
Yeah, we would do at least the
Misdiagnosed,
first,
yeah.
exactly. We would do the first, the first basic screening, and then we would hand it off to, and that's the same model that Vision to Learn, they first come in with the vans, they do the test, and then they identify students that need to be seen by an optometrist, and then that's where they start diagnosing some of the, eye health issues.
So if you did 100 visits a year and you roughly are 69,000 in equipment and mobile costs, granted some fuel costs and stuff, you're talking about $700 a clinic. Pretty cheap.
And we're looking at about, $49 per exam and custom made glasses per patient.
Yeah, plus the $700 in equipment, it's a pretty low cost. To run a clinic for $700 in a day and treat, I don't know how many kids, 100 kids maybe within my, on a
Yeah.
clinic day, 50 to 100.
Yeah.
Yeah, so you're talking at most.
And we could just work with the school districts and just be at a different school, or, so the possibilities are endless, and that's why.
You're talking like $7 to $14 just to get the equipment there per patient. It's pretty cheap.
Yeah.
You can't even drive a clinic for that much. Seriously.
Yeah, no, yeah, and I think this is a really great, especially with, strategy 2.22, in our new strategic plan, expanding care, and I think this is specialty care that is severely needed out in the community.
Yeah, you could just put a dental mobile next. There's there's no dental care for these people either. That's all I need.
That have something cooking in the
Good.
back burner.
Well,
So,
I think the other thing, we'll make a motion to vote on this and approve it, but let's really think about the situation we're in now and how you structure this differently.
Yeah.
I think now's the time to really grow what you're
Yeah.
thinking. If you're gonna jump in, let's just think about how you maintain control so you don't get a 9-month gap where we're kind of caught, like we can't do anything. We don't want that to happen here. So I think let's just make sure we structure that right, whether we need to get a license, whether we need to have a license with an optometrist. I don't know what we need, but we want to be able to go execute and not be kind of burdened by the.
We're gonna go the route of using RFPs for all of our operators, and even though less than I can probably be the most qualified, so
We
we
should.
for an RFP to see what's what they can do.
Yeah,
People,
yeah, I think that.
And that's why we wanted to, raise awareness about the previous issue and then present these, and all of this conversation, all three of us sat in with our legal counsel to make sure that, we ran everything to him before we provided the recommendation
Yeah.
to FNA, then ultimately the board, because we were also in agreement with you, Dr. Lago, that we don't want to end up being in the same situation with any of our,
Just part of that, the vetting process is gonna be critical, because it's not like, somebody who's supplying food for a project and, oh, okay, we'll find somebody else to do it. I mean, it's really people delivering care. And so, we just had, I think, Activate Inclusion dissolve. And if they dissolve and form another entity, they gotta get another license. So it's the same thing with these people. We gotta make sure they've got a track record, and it's a lot. So, okay.
What is the timeline for the RFP?
We're
And the
hoping-
dollar amount, is it as early as this month or are we gonna put that?
As soon as board provides direction,
Okay.
we'll start crafting that and then,
I will move approval of option one.
Second.
All in
Purchase of
favor?
mobile vision unit and optical fabrication equipment and a request for proposal.
All in favor?
Aye.
Any public comment?
None.
Is this something that's gonna have to wait till August to get moving? Not meeting anymore? We go dark in,
well, the
we
beauty,
dark in August,
We
right?
can start the RFP.
Yeah.
I
Do
mean,
you need
the board
anything for,
appro- The board approves your recommendation for option one.
okay, then you can
So
start,
that
okay,
way, right.
yeah, I think you should.
We both order
Yeah, we could get it out sooner. So
Yeah.
we don't miss a month.
provision and
Okay. Less than act.
Less Than Act is our current,
Yep.
partner that provides the vision clinics. We want to extend their contract, for another 18 clinics, so. We want, as the RFP for the operator is, doing this thing, we want to ensure that we continue to provide vision services. So this will be the bridge for those services.
did you vote on, so if we say option one,
Option one.
then the mobile clinic cost, did we?
Yeah, that's what I was curious about, waiting for an
Because we're
opening,
talking
is
about
that
Magnum and the other one.
we did the RFP, but do we have to give you the okay to start, entertaining, contracts with, to purchase the
That's true.
vehicle,
Yes.
right?
That's fine. Yeah, we can
Yeah,
get-
so when you bring that, can you put an up to dollar amount, because something reasonable but with responsible? That way we could actually do that, because it's gonna take several months to actually outfit it, right?
To build it.
Oh,
Yeah, so
we
they're
need to
looking
get that
into,
going.
So that's the reason for extending the contract, so the services are uninterrupted for them. If we are
So
approving
bring it-
buying
bring it
new
with a-
ones, then
Whatever you suggest, but a wider range, I think your total costs were 243, so I don't know if 300 gives you a 20% buffer.
We'll have to factor in, like, because if, say, mobile, if it was Magnum's in Arizona, so we have to pay sales tax when registered in California, where it does, but part of what Alejandro had prepped, so I could look at was kind of make sure we're comparing the like items, each of them have elements that the others don't, so trying to get it down
Correct.
to a format that is competitive. But I just want to make sure, so we're leaning towards not only the recommendation for option one for the
Yeah.
July meeting, but also bringing back a value that covers the purchase of the unit.
So you could start the order of getting it going.
but rate that, you have to show for you guys.
Well, that's what we were talking about. That's what I think it was, so she was bringing up, it's like, should we just agree that,
Just to be, we'll maybe start with RFP, and then that will bring back a formal proposal.
for the unit,
Unit itself.
that's
So
probably.
we can't do that today up to a certain dollar amount, because we would have to bring the contracts from the potential
Because it
vendors.
wasn't on.
Yeah, it's not, yeah, we have to just
Okay,
define.
so step by,
And
yeah,
if you approve the less than that, I mean, we've got some legal, we've got times.
That's fine.
Okay.
that's
Yeah.
okay.
so yeah, we just wanted to get guidance and then we would come back and, Donna
Yeah.
had mentioned that in,
No, we're not meeting in
conversation that.
August, I'm just like, that's 2 months and I don't wanna hold you up 2 months.
No, yeah, no, and I think with this, if y'all approve and the board approves the extension, the Less Than Act, that will be the bridge that would carry us.
So you'd be comfortable with that.
Yeah, so that would be the bridge while the mobile unit is getting built and we do the RFP process for the operator. Then as soon as the operator, could take, possession of the Vision mobile unit, that's where we will start.
And maybe provide input as to how it's outfitted.
Exactly.
So September, after they would bring forward a proposal for the purchase. The mobile unit and the equipment. Yes.
And then-
Look at the vendor. Through purchasing as well.
Just to make sure that's how they did it. They may tell you that, yeah, we ran it through that. And you're like, okay, done.
So there's two costs, right? The mobile unit and the equipment, and then the operational cost. So we're,
It's the variable expense.
Yeah.
Everything, I'll be just concerned about the fixed cost.
okay,
Meanwhile, we have the RFP approved. President.
Yes.
Okay.
Alright, so now,
Perfectly.
Yes. no, we wanna make sure.
The operator.
We gotta give it short. We don't wanna go one without the other. Then we'll have a horse with no jockey. So.
Less than Act has their own vehicle, they do this in. or
They do, but that vehicle, they have two that service through 4 counties. So, trying to get them out here, it's on a monthly basis, it's a stretch. So that's why I think,
They've agreed to these.
they did agree to at least 2 clinics a month, in this extension.
Do they have staff to help cover? Is that?
Well, what they're doing is actually for this agreement, if it's approved, they are gonna look to hire 3 local individuals. So then those 3 individuals will be based out of the Coachella Valley for these 18.
Perfect.
Yeah,
That's perfect.
yeah, and so they don't have to commute back and forth, because it's a 2-hour drive from
Yeah, I know.
Orange, where their
That's
house, to here, and then the wear and tear on the vehicle, so that's why, having our own mobile unit and then having somebody like Lesenex to operate it makes it a little bit better, because
Yes.
anybody that's coming out of town, they're gonna charge us that mileage, the gas, the maintenance, wear and tear on the vehicle, which, it,
I was telling my ophthalmologist who did my cataract surgery, he said, oh, if you're gonna have one, have it on Saturdays, so he's a volunteer.
Yeah, I mean, they'll come out, people will come out on Saturdays and work, they love this stuff.
Yes.
Especially if you provide all the equipment and everything, and they just show up to do their job,
Volunteer.
yeah.
so just providing the platform.
Oh, if you provide the
Yeah.
platform, the ability to make the glasses, they'll come out and do all that.
And it's, there's even some, with, one of our foundation staff members, George, who is a Lions Club member, he said even the Lions Club might be if we go into to provide some grant dollars, because they do the same, but they only have one mobile unit that services all of Southern California. And they haven't had one out here in, he said, a couple of years.
Even IHP and Medi-Cal would consider even contracting through you to go service their patients, so, okay. So we just need to make a motion to approve this for. For less than 147 Johnson.
I move approval.
I will second with the clarification, because I think the agenda called this a 6-month services agreement,
Mhm.
but it's not 6, right? It's
6 with 12 clinics. So.
Or 18.
18, it has
Oh,
up
yeah.
to 3 per month. But
August to June.
Right.
Mhm. So 9 months,
That's
so
9.
it's 2, 9 months. Okay.
That's how we know. Anyway.
yeah, you're right.
Sorry.
Yeah, you're right, yeah.
It's okay.
I know, it's 2 per month for 9 months, yeah.
Yeah, 2 per.
All in favor?
Aye.
Aye, thank you. Next one is, any public comment?
No.
CV Pharmacy 11-month service agreement. It's the next one.
Yeah.
So the amount is reasonable. You've been happy with them?
We've been extremely happy with them. They did an amazing job. Some of just the numbers from the previous, year, which was only for 3 months. We were able to host 29 vaccination clinics at 25 different locations. We were able to administer 1,141 total doses. The breakdown of those were 694 flu, 431 COVID, 5 RSV, 6 shingles, and 5 pneumonia. A total of 919 district residents benefited from this service. And 35% of those, 321 of them, were uninsured or underinsured.
And these were throughout the
district residents.
Coachella Valley.
And this was throughout the Coachella Valley, that is correct, yes. And we had a conversation this morning on, just giving updates on what we have planned for the future, and our first target population, which is the highest at risk, is always the seniors. So we first start off by reaching out to seniors and, boarding care facilities to provide the services to them directly at those locations. And then we move on to faith-based schools, et cetera. So our traditional host sites that we have with that. One of the great things too, that if approved, we could actually supplement our monthly locations, where we would take our mobile clinic as, provide them with this service, instead of the traditional primary care and specialty services that we would provide to our mobile clinics. We would at least be able to have this like a Band-Aid solution to at least start September 1 when flu season, begins, kind of go back to some of those monthly sites to continue the partnership, still say, hey, we're still here. We're just working through a couple of things that we have notified a lot of those locations already.
Most of these seniors Medicare, they all insured. So that-
Yeah, so what these grant dollars will go to would be only for underinsured and uninsured folks, not insured folks. So we don't pay for the vaccine reimbursement to CV pharmacy for folks that they're able to bill the insurance for those, for the vaccine and those services. Yeah. And just for, further clarification, I know Dr. Lodson in one of the board meetings, you wanted to possibly include RSV, pneumonia, and shingles. The price tag for those are per vaccine are pretty high. We're looking at the RSV, $325 per dose. Pneumonia is $346 and shingles is $250. Yeah. So, I don't know if you wanted to include that in this, and that's where we would like
That came from them pricing it.
from CV Pharmacy, yeah, directly from them, yeah.
FQHCs have a not AB, but that special SB or something.
Two forty
Vaccination,
B.
240B, 240B,
340B.
340.
I mean, everybody has it now. They're looking
Yeah,
into
I
it.
mean-
Yeah, it's supposed to be for rural areas. Yeah, but you should be able to get it. I need to look at the pricing and just see. So, okay. Thank you for that thing.
So the question to FNA is, would we want to include these RSV, pneumonia, and shingles to cover uninsured folks as part of this agreement with CD Pharmacy? In previous years, we've only approved the flu, regular dose, COVID, and the flu high dose for seniors. Those are the only ones that we covered.
Did you check in the other pharmacies of those persons around the same time?
I'll check right now.
Yes.
Pretty standard. Yeah, they could be expensive. I don't know.
So if we have like a small quantity, could we then identify the people that are most, at risk to get them? And maybe have a smaller quantity than, 1,000 for, the regulars and.
US aging.
Yeah, so that was part of, if y'all wanted to go that route, my recommendation was to cap it at a certain number. So we wouldn't, be going into 1,000 vaccines at a $325 each. That number could balloon really quickly, and we're only, we only allocated $150,000 for this, but if we're able to include some of those numbers could,
And he had mentioned in our
Below.
session too, that one had that US aging grant, that pass-through money from the feds,
Yeah.
that they would offer those, and we had like what, hardly any.
yeah, we have 5, 6, 5,
Yeah.
so very few.
Very few.
Very few, because a lot of those are,
Okay.
targeting seniors, and seniors typically,
Right.
That's why I thought the
Yeah,
RSV
Medicare.
and some of the stuff targeting the younger population, the kids that may not have the coverage,
Yeah.
Medicaid should cover it too.
yeah, that's why we didn't see, such high numbers. because
I'm
a
just
lot of-
curious what the actual rate of, RSV vaccination is in Coachella Valley. I'm just curious if they just can't get access to it. They may have Medicaid, they just don't get it. So.
I'm gonna move the
Sounds good.
the one that you have right now included without the RSV and the shingles.
Okay. Yeah.
And maybe you could do like a survey as you're administering and asking, if we had it, would you be interested?
Mhm.
So we could kind of accumulate some data.
Do you have shingles? Have you ever had shingles? Did you get the shingles vaccine? That'll tell you. I mean, I know 2 people this year that have got shingles.
Every
They were
time you go
younger.
to CVS, would you like to schedule your shingle shot and your pneumonia shot? I'm like, no.
I know one person who had it last year. Shingles really bad.
It's painful, I had it with days now.
Oh, it makes me itchy to think about it.
It's not even pain, it's more like just this shooting pains.
Do you want to
But if we could get that kind of
Yeah.
just initial
If you
data.
had
No,
chicken
it's just
pox,
clarification again
your,
from the
your
agenda.
subject.
Can you confirm the length of this? It's
It's the flu season.
It's 7 months.
7 months, yeah, from September 1 all the way through March
But
30.
not 11.
So now
Oh my goodness, doing your remarks, having them all
Perdón,
ready.
Ron, I'm so sorry.
Eagle eye over here.
Yeah.
He's in.
I'm so sorry, yeah, that was.
This is good.
And the other one is 9 months, right?
Yeah.
The other one is,
What, I'm sorry, CV pharmacy is actually 11.
11.
Starts August 1st
Mhm.
through there. It's just the cost
oh, so it's 11 months. Yeah.
is based on work in each of the agenda.
So I have to explain in that, in the documentation, what Eric is just saying, but let's not cover that again, though. Can we move on?
Yeah.
You know what I'm talking about? Without the RSV and shingles, right?
Yeah.
Without.
Without it.
And the motion.
But try to accumulate some
I think
data.
I seconded.
Second, all right, all in favor?
Aye.
Aye, any public comment?
None.
Okay, seeing none. And no other committee member comments, we're gonna adjourn and go straight into the foundation meeting at 4:30 PM.